this morning we are talking with Dr. James LaValle. He is a metabolic expert and author of a number of books. Good morning, Dr. LaValle.
Good morning.
So you are a doctor of what? What is your specialty?
Well, I'm a clinical pharmacist, and I'm boarded in clinical nutrition, and I've got a naturopathic medicine degree. But, my specialty, and really what I teach doctors all over the world, is how to tear people's chemistries apart and figure out a precision and personalized plan to get people back to their best health. It's whatever works care, right? What can we do to really get you to the best place that you can be? And, of course, let's do lifestyle care first, right? What are you doing that could be limiting your health? And that's kind of what I write about, and that's what I've been teaching for the last 37 years.
And in that effort to get us to the best that we can be, you have 3 healthy belly habits that we should have. What are those 3 habits?
Well, it's interesting. It's quick. It's eat, move, chill. But what they are is the first is learning how to eat in order to help your beneficial flora or the good bugs or probiotics flourish in your gut. And that's important because your gut has 70% of your immune system. And so eating foods that are higher in fiber, using things like chia seeds, hemp parts, taking psyllium, really important. Eating lots of leafy dark greens, high in prebiotic fibers so that you're feeding the beneficial flora with prebiotics. Artichokes are good at that, maybe a little bit of oatmeal, certainly apples. But the big thing is that you got to restrict how much sugar you're eating. You should really watch. This is on the belly buster side. Really watch what you're eating. So watch the sugars, watch the saturated fat. And I recommend, because most people are on different medications or they're under a lot of stress or they're not eating right, take a probiotic that's been proven in human clinical trials that can benefit their health. Good beneficial flora is one of our best immune defenses to now this big COVID-19 experience, but just influenza virus in general, because it affects thousands and thousands of people every year.
So you were talking about prebiotics. Of course, we have all heard now of probiotics. What's the difference? What are prebiotics?
So, probiotics are the bugs that are in your gut that live there and actually dictate how your immune system's going to function, whether you're absorbing nutrients or not, how you're processing hormones. Prebiotics are the foods, and basically they're fiber that goes into the intestine and feeds the probiotics so that you can have better diversity and better flora expression in your gut. Green leafy vegetables are awesome at it. That's really one of the best things you can do, is try to really stock up on the green leafies. And those are the foods that will really help you to feed the probiotics in your gut. So you kind of need both. Think about taking a probiotic, think about eating to keep those probiotics healthy.
So we have those 3 healthy belly habits. What are the 5 belly busters that we need to break to make sure we get our microbiome back on track?
Well, obviously, if you're on medication, so things that are like nostril anti-inflammatory drugs, pain medications that are over-the-counter, acid-blocking medications also change your probiotic flora. Being on antibiotics does it. Smoking does it. Eating sugar does it. Drinking alcohol every day. Too much alcohol every day, and that's above that 1 drink a day limit, you're gonna affect the microflora. And remember, exercise is really important as well. When you exercise regularly, you actually build your beneficial flora in your gut. And it can be intense exercise or intermediate exercise. It doesn't have to be all hard exercise. Moderate exercise works well. And just remember the last thing, sleep and stress are 2 big things that can affect your gut health. The less you sleep and the more you disrupt your body's natural rhythm, it's been shown your beneficial flora suffer. And we do know that people under high stress end up affecting their immune system, and a lot of that's due to changes in the microflora or the probiotic network in your body.
So, Dr. LaValle, do you have any maybe tips to help us try to move from the sugary, high-fat foods into some of these more healthier foods?
I think the tip is don't eat them, right? I mean, I've been in practice for 38 years, and when people come in and talk to me, and I mainly counsel people on how are you going to eat, what nutrients do you need to take, what's your blood test look like, what's the safest drug for you to use. It all starts with learning how to eat, and you know what? No, I'm sorry. You can't have sweets every day. No, it's not right to finish every meal with a dessert. If you want to start with one thing, go to dark chocolate versus milk chocolate. right? That's an easy one. Dark chocolate actually is high in prebiotics and lower in sugar. And, we have to start to make these kind of decisions for our lifestyle. We've heard this forever.
Right.
Don't eat as much fried food. Don't eat as much high sugar foods. But you got to watch. People will drink a green drink. They think they're drinking something healthy. You got to look on the back of it. It could have 80 grams of sugar in it, which is more than drinking a can of soda. So it's learning to be a wise consumer of your food. Try to take a plate, make half that plate vegetables, make a quarter of the plate protein, and maybe a quarter of the plate starch. Yeah, that's a great place for you to start, which a lot of people don't do now. I mean, it's lucky if people eat a vegetable a day,
right,
and they should at least be striving to get 8 or 9 in.
So do you have a website, Facebook page, any place that we can get a little bit more information about this?
Sure. I mean, if you're interested in probiotics, you can go to probiotics.com for cutting-edge information on probiotics. And then for me, you can go to jimlavelle.com, and, of course, all my Facebook stuff's all attached to that.
Dr. James LaValle, metabolic expert and author. A pleasure. Thanks so much for joining us this morning. Appreciate your time.
Oh, thank you for having me. It was a pleasure.